Hi, my name is Brittany Torrijos, and my presentation today will be on UCLAHealth, a company located in the United States of America. The worksite health promotion program I am proposing is called Eat Well, Be Well. The goal of this program is to expand current worksite health promotion to include access to healthy food options on site and to motivate employees to make healthy food choices. UCLA Health is one of the most comprehensive and technologically advanced healthcare systems in the world. Their mission is to deliver cutting-edge patient care, research, and education. UCLA Health comprises of 4 hospitals, including Ronald Reagan UCLA Medical Center, UCLA Mattel Children's Hospital, Stuart and Linda Resnick Neuropsychiatric Hospital, and UCLA Medical Center located in Santa Monica. In addition, the health system includes the UCLA Medical Group with more than 170 primary and specialty care clinics throughout Southern California. UCLA places number 1 in LA and number 7 in the country according to a recent U.S. News and World Report survey on hospitals. UCLA has 20,000 employees. Career areas include research, clinical, and non-clinical areas. Staff includes registered nurses or RNs, physicians, clinical faculty, residents and fellows, IT, managers, and executives. UCLA Health is located in the United States of America. The United States has a life expectancy of 76 for males and 81 years of age for females. The U.S. spends 17.1% of its GDP, or gross domestic product, on healthcare. The United States does not offer universal healthcare coverage. Rather, citizens are covered either through public or private insurance. Public insurance includes Medicare and Medicaid. Private insurance companies are either PPOs or HMOs. Furthermore, 61% of those insured are insured through employers. Non-communicable diseases or chronic diseases account for 88% of total deaths. The probability of dying between ages 30 and 70 from the 4 main non-communicable diseases is 14%. As you can see, 31% of mortality is attributed to cardiovascular disease. Another 23% is attributed to other NCDs. 23% is attributed to cancers. Chronic respiratory disease is attributed to 8% of mortality. Communicable, maternal, perinatal, and nutritional conditions are 6% of mortality. Injuries are another 6%, and diabetes accounts for 3%. As you can see, NCDs account for a huge portion of mortality. Modifiable risk behaviors that increase the risk of NCDs are tobacco use, physical inactivity, unhealthy diet, and alcohol use. Tobacco accounts for over 7.2 million deaths per year. Furthermore, an additional 4.1 million deaths have been attributed to excess salt intake. 1.6 million deaths every year can also be attributed to insufficient physical inactivity. The American culture and mentality includes diversity. The USA is often called a melting pot, a mix of a wide variety of nationality and races. Another key aspect of American culture is the Western diet, which includes processed foods and large portions. Another aspect is a great interest in sports and competition. While I was not able to communicate directly with the CEO, I was able to retrieve valuable information from the company website. UCLA Health has more than 20,000 employees. They do have a current work health promotion program called the Wellness Initiative, whose goal is to be the catalyst for a healthy dose of motivation for health promoting behaviors amongst employees. Current characteristics of this program include Bruin Break, which is a 10-minute instant recess for employees where they engage collectively in workout activities. They also have access to free fitness and classes, including dance, meditation, and yoga. They also have nutritional guides available for them, counseling on smoking cessation, and access to the UCLA Rec Center. So my goal is to expand current work health promotion programs to include access to healthy food options on site and to motivate employees to make healthy food choices. So my program, Eat Well, Be Well, will not only benefit the company, it'll also benefit the employees. So benefits for the company include reduced health insurance costs, reduced absenteeism, reduced presenteeism, and it also helps to maintain healthy corporate culture. Benefits of the program to the employee include access to healthy food options on site, education counseling on proper diet. Through eating healthy and becoming more physically active, it can help decrease stress levels, it can lower body mass index, and it can also increase energy level and productivity at work. And lastly, can also reduce healthcare costs. So obesity is one of the key risk behaviors that leads to the high prevalence of non-communicable diseases in the United States. So the goal is to encourage healthy food choices amongst employees by providing healthy and diverse food options on site, and also by educating employees on healthy food choices. By doing so, the overall goal is to improve employee health and decrease the prevalence of obesity, which is one of the leading risk behaviors associated with NCDs. And to determine the specific needs of UCLA Health employees and to determine what type of program should be implemented, I will be designing a survey which will be a combination of free response questions and also multiple choice questions. Examples of these questions would be as follows, like what kind of healthy food choices would you like to see available at work, and also how often do you eat healthy food at work. So by designing these surveys, we're getting valuable information from the employees that will help with effective implementation of this worksite health promotion program. Furthermore, I will be educating employees on a key health issue of obesity. Between 2015 and 2016, the prevalence of obesity was 39.8% and affected about 93.3 million U.S. adults. In 2008, the estimated annual medical cost of obesity in the United States was $147 billion. So, in order to educate the employees, I will be doing so through formal education and informal education. So, formal education is set up in more of a classroom type setting and will be educating employees on the negative consequences of obesity and also on the importance of eating healthy and nutritious foods, and also informal education, which will be a multimedia campaign including creating webinars, brochures, and posters about these health topics and issues. So the strategy I plan to implement will be a mix, as I said, of formal education, informal education, and also counseling, which will include access to nutritionists who will be available to tailor individualized plans for employees. And also, one of the major strategies I want to implement will be the creation of a healthy and nutritious cafeteria with diverse food options that are healthy. The creation of this new green cafeteria will offer healthy vegetables, fruits, whole grains, and will also provide incentives for choosing healthier food choices, such as making healthier food options less expensive. And also, another aspect of this cafeteria will be to offer free, diverse, healthy cooking classes on various cuisines ranging from Italian, Chinese, Mexican cuisine, and also American cuisine. To evaluate the program, I will utilize surveys and group discussions throughout the program. And the health improvements I expect to achieve will be weight loss and lower BMIs or body mass index, lower rates of obesity, and thus the lower prevalence of non-communicable diseases. And I will measure feedback by the response rates I get from surveys and the participation in discussion groups mid-implementation. This is really important to determine how effective and efficient the program is, and to also determine what changes need to be made. And I will be in constant contact with the CEO during implementation, as it is imperative to have top management support for worksite health promotion programs. And the future of UCLA Health. UCLA Health is one of the most comprehensive and advanced healthcare systems in the world, and delivering effective patient care starts with healthy employees. So it is imperative to continue and expand current worksite health promotion programs, as it benefits both the employer and the employee. Benefits to the employer are reduced absenteeism, as it has been determined that absenteeism has cost employees over $40 billion per year. So by encouraging these programs, they can significantly reduce that. Furthermore, there are also benefits to the employee, which include greater overall health and a decreased risk for obesity, and therefore decreased risk for non-communicable diseases. So my recommendations for the future are to continue these worksite health promotion programs and to expand them, and also to include healthy vending machines with fruit and vegetable options instead of the traditional chips, cookies, and soda, and also to encourage employees to increase their physical activity level. This can be done through engaging in walking clubs. And this is my list of references, and thank you for listening to my presentation.